I'm in Dr. Ginsburg's office, and I'm about to have the procedure. Now, you see me right now, I'm really not like fat, you know, huge, but later on when they pump me full of fluids, I'm gonna look like a blimp. Because, you know, they did the chin, my face was really big. So you see right now, not really that big, but there, you know, some of the midsection is gonna come down a little bit, okay? And I'm gonna be flat stomach, all right. And the surgery is supposed to start in a few minutes. So we'll see you in a minute.
I administer the anesthetic solution, which is a mixture of lidocaine to numb you, epinephrine, which constricts your blood vessels so you don't have much blood loss, and there's also Kenalog in it, which helps with the swelling afterwards. And so I insert a small tube, and I basically fill your skin up with fluid, so you're going to feel like you're getting blown up like a water balloon, okay? You feel a few little bee stings as it goes in, but that's probably the maximum amount of pain you'll experience during that procedure. It's not bad. In fact, I would rather do this than go to the dentist. It's really pain-free.
Okay, no, it doesn't really hurt. It pinches a little bit, but it doesn't really hurt, you know.
So you experience that fullness as the fluid goes in. So once it's good and numb, then Dr. Ginsburg will come in and he will use the laser on you and laze the area and then do the sectioning. So it's a pretty simple, easy procedure.
Smart laser lipo involves the administration of local anesthesia, which Julie just described to you. And once that's done, then through tiny little holes, we insert a laser on a very thin wire and laser the area for about 20 to 30 minutes, which hits the skin, which allows for much better skin retraction and melts some of the fat. That's followed by suctioning of the melted fat plus the deeper fat. Liposuction can do what weight loss can't do. And some people need to realize the fact that you don't have to lose weight to have a successful liposuction. If you're overweight, it still is very important to lose the weight, but you don't have to lose the weight first. 95% of the time, it's not necessary to remove skin. I think it is now the most popular cosmetic procedure performed. I don't know how that stands up to breast augmentation, and I'm not counting Botox and fillers, but as far as a surgical type cosmetic procedure, it's up there with breast implants. So it's going to be here, all of this here, and then we go around and we get the love handles.
I'm just going to press down and start pumping it in. Here we go.
Woo! It's getting big! I'm really not this fat. Wow.
If you look closely, you can see the red under the skin. That's the head of the laser fiber. And by passing it repeatedly under the skin, it has, the triplex laser actually has 3 heads on it. One is primarily for skin tightening. One is, and the other 2 are more for coagulation of blood and for melting of fat. His skin is very tight. There's not going to be an issue, especially on the sides here, with the ability for his skin to retract in an easy way. So he doesn't need this on his sides as much as he does. He has a little more skin on his lower abdomen. So I'm going to be a little bit more aggressive on the abdomen when I laser than I will on the sides.
I'm cool. I'm cool. Piece of cake. Which I could really go for right now, a piece of cake. I'm saying.
See, it looks big here and here because there's still fluid here. But this is the dip of his waist now. He's got a waist. You pinch it, and that's about the right amount of fat to have. The experience of the operator comes in 2 places. One is what to do. You know, someone comes in and they say, I want liposuction, and you can't do everything at one time in some So knowing what to do, where to start and stop is a very important part of a successful procedure. And then, even more important is when to stop. You know, when is enough enough? And when isn't enough enough? When, you know, you want to take out the right amount, but taking out too much is worse than not taking out enough, because you can always go back and take out more.
This halcyon's got me feeling really good. Really good.
Even when I finish, he'll still have a gallon of fluid in him. And that gallon of fluid is going to be absorbed and then peed out or drains out of these little holes. So it's somewhat amazing that you can see the difference immediately.